Evelyn's particular problem was a fracture of one of the lumbar vertebrae. Okay, so a compression fracture, almost surely related to age-related weakening of the bone, or osteoporosis, or osteopenia. Very common, ubiquitous problem in our elderly population. We see these injuries all the time, and some people just don't do well with the usual non-operative care, like bracing or a little medication. Evelyn's a very active woman, goes to church every day, takes care of her husband who has some medical problems, and really was impatient and very concerned about the fact that she was having a great deal of back pain in relation to this fracture that was limiting her with respect to her responsibilities in life. And so that was the problem she had, and we had a very nice, minimally invasive solution for her, which was this procedure of kyphoplasty, which is done through very small incisions, 1 centimeter incisions in the back, I think one on each side for her. And it's a way of introducing a small cannula that can then place cement into the fractured or the broken vertebra and provide kind of like an internal support or brace for the fracture. And it generally, is very efficient to perform, half hour, 45 minutes, and there's no blood loss associated with it. And obviously not a lot of tissue trauma related to that type of surgery, so patients can get up within an hour or two of surgery and walk and move around, and that was certainly my recollection of Evelyn's case. She was, jumping out of the bed, wanting to go home very early after her surgery. I was going back to see her later in the day, and she was already pushing to go, so that's somewhat a function of her personality and her forthright manner, but it's also a nature of the type of procedure she had. And again, the message is a well-selected patient with the appropriate type of problem that can then be managed in with a small or percutaneous procedure is really a perfect operation. No need to do this in the hospital setting and waste all the resources that go along with a hospital-based procedure for this type of percutaneous operation.
I had a broken vertebrae and I was in a lot of pain. I thought that I was very strong, was going to help my husband, and I caused myself a lot of harm. And I came to see Dr. Palumbo, and very quickly he got me into the surgery center to take care of the problem, which was that cement that they put in the vertebrae. And I was just so grateful, because I need to keep life going, and being with lots of grandchildren and lots of family to take care of. So very quickly, and I couldn't say enough good things about all the staff and everybody that came from when we first come in until the very end. Everybody couldn't have been nicer. Very accommodating, very concerned about how I was feeling, making sure I understood everything that was going on. And I did. I was, I felt very comfortable. And I recovered very quickly. I was able to just, very next morning, able to drive. And I was fine, and I'm doing really well.